Hello, this is Dr. Gary Siskin, and today I'm going to be giving the second lecture on mechanical embolic agents, which is part of a larger series of lectures on embolization in general. Remember, mechanical agents are those that are deployed right at the site of a vascular abnormality and include coils and plugs and other more rarely used devices by interventional radiologists. This lecture is going to focus on plugs. And it's important to talk specifically about plugs because there are a growing number of plugs that are now available for use. I consider plugs to be bulkier, fancier, and more complicated versions of detachable coils. Plugs occupy more space within a vessel than a single coil, and as a result, plugs have the potential of being the only device needed for vessel occlusion. Most of the available plugs are attached to a pusher wire and are released by rotating the pusher wire until the plug is detached. Others are pushed through a catheter or sheath and are deployed by uncovering them in a manner that's similar to IVC filters. So let's talk about the available plugs, which can be classified as either uncovered plugs, covered plugs, or polymer plugs. And I would say the most commonly used uncovered plug by peripheral interventionalists are the Amplatz or vascular plugs. This is the AVP2, which is a tri-lobed nitinol mesh plug, which is attached to a 135 centimeter nitinol wire via a stainless steel connector. There are two radio-opaque platinum markers located at each end of the plug, and this plug is generally delivered through either a sheath or guide catheter and is more commonly used for larger vessels. When deploying these plugs, 30 to 50% oversizing is recommended. Now, I'm not going to go through each of the individual specs about these plugs. This is included for your own reference at a later time, but I do want to draw your attention to the image on the right side of the slide. You can see the top picture of the plug is generally what the plug will look like if it's slightly undersized for the vessel. This is the unconstrained picture of the plug. The plug below it, let's labeled as C in the picture, is what this plug will generally look like if it's deployed in a manner which is slightly oversized. Usually I try to aim for somewhere in between the two pictures, but the point that these images are trying to make is as you put a given size plug into a vessel that's too small, it's going to lengthen out and look more like the bottom image than the top image. The newer version of the Amplatz or vascular plug is the AVP4, and this is a bilobed nitinol mesh plug, again attached to a stainless steel wire this time via a stainless steel connector. In a manner that's similar to the AVP2, there are two radio-opaque platinum markers at each end of the plug, and the major difference here is that this plug is generally delivered through an angiographic catheter and is used in vessels 8 millimeters or smaller. The catheter has to have an 0.38 inner diameter, and again, 30 to 50% oversizing is recommended. Just like when I discussed the AVP2, if you look at the image on the right side of the screen, you can see what the unconstrained appearance of the plug looks like, as well as the plug as it's lengthened out in a vessel that's slightly smaller than the diameter of the plug. The AVP4 is an appealing plug to use because it does go through a standard angiographic catheter. I just included this example of a splenic artery embolization in a trauma patient where a single AVP4 plug was used to cause an occlusion. The key here is just waiting a couple of minutes after the plug is deployed. I confess to you, it is generally hard to wait for 5 minutes or so once you deploy an embolic device, but if you do, in all likelihood, the vessel will be occluded in that amount of time. The Microvascular plug, or MVP, is another plug available for use. This plug has a cage that's composed of nitinol covered by a PTFE membrane at its proximal portion. There's a single radio-opaque marker at the proximal and distal tips of the nitinol exoskeleton, and the plug is connected to a pusher wire, which is an 018 wire for the 3 and 5 millimeter sizes, and an 027 wire for the 7 and 9 millimeter sizes. And the wire is detached from the plug by rotating it counterclockwise. Here are the specs for the different models of the MVP plug, and I just want to draw your attention to the last column on the right, which shows the minimum ID of the catheter required to deploy or deliver the different sizes. And the smallest sizes, the 3 millimeter and 5 millimeter versions, can be introduced through microcatheters, and the larger versions need standard angiographic catheters for delivery. One of the nice things about using plugs is the ability to control both the leading edge of the device and the trailing edge of the device due to the fact that markers are present on both ends. So when you're embolizing something like a gastroduodenal artery, as in this case, you can very clearly see where the markers are going to end up, and you can precisely place either end of the device by using the markers and understanding what they mean relative to the way the device is deployed. The ArtVentive EOS device is another plug that's made of a nitinol coil covered with a PTFE membrane. It has enough radial force to provide good vessel apposition and prevent migration, but it also doesn't have enough radial force to cause significant damage to the vessel wall. It's a self-expanding device and very flexible, and it adapts well to the shape of the vessel, and actually each segment of the device can adapt separately to any unique turns that the vessel may take. This plug requires a larger size delivery catheter, and once you have that in place, you use that handle and pull back on each of the levers to first deploy the proximal end of the plug, and then you deploy the distal end of the plug and release it. There are 3 different plugs which have been even more recently introduced. The first is the Hourglass device. This is an hourglass-shaped nitinol frame, the proximal half of which is covered by PTFE, and you can think about it as a stent that's crimped in the middle. This device is meant for use in vessels with a diameter of 3 to 8 millimeters, and the unconstrained device measures 20 millimeters in length and 10 millimeters in diameter. The distal or uncovered end of the device is meant to act as an anchor, while the covered proximal end acts to occlude blood flow. One of the challenges in using any of these plugs is understanding the markers that you're seeing under fluoro before you deploy the device. In this particular case, there are at least 3 markers along the length of the plug, as well as a marker at the tip of the delivery catheter, which is a proprietary system that goes over an 018 wire. Once you retract the delivery catheter and start delivering or deploying the plug, you do have the option to retract the plug back into the catheter until you deploy at least the first half of the plug. The Caterpillar plug is another one of these new plugs. This consists of a cobalt chrome stem, nickel titanium fibers, and platinum iridium marker bands, as well as an occlusion membrane that's made of polyurethane and polyethylene. The device was engineered to enable embolization through a balance of mechanical occlusion by the occlusion membrane and thrombus formation within the nickel titanium fibers. The device is delivered through an appropriately sized catheter and then uncovered. Once the first half is completely uncovered, it can no longer be retracted back into the catheter. And once the device is deployed in its entirety, you have to turn the pusher wire in order to release the plug into the vessel. There are 3 different models of this plug covering different size vessels, with the first model, the 027 device, being appropriately used in 1.5 to 4 millimeter arteries. The second device, the 038 device, goes into vessels 3 to 6 millimeters in diameter. And the third device, which is the 056 device, goes into vessels 5 to 7 millimeters in diameter. You should recognize that the name of the device corresponds to the inner diameter of the catheter that you need to deliver the device where it needs to go. And this is what the device looks like under fluoro in a patient with pelvic venous disease. I just highlighted what the markers look like when the device is deployed, which you can see on the image right next to the picture of the plug. And finally, I want to go over the new polymer plug, which is called the Impede embolization plug. There's two models of this plug which I'm going to review. The first is the Impede Embolization plug. This consists of a shape memory polymer and an anchor coil. There's a single marker at the proximal end of the plug, but of course the coil is radiopaque as well. The anchor coil is made of an alloy of platinum and iridium. It's threaded over a nitinol wire and wrapped around a stainless steel mandrel. The radial force is about 4 times less than a similarly sized Amplatzer plug, or the AVP2. The dominant component of this plug is the porous polymer, and this is capable of self-expanding into a larger shape that conforms to the target vessel. Once this plug is deployed, blood flows through the device and forms a dense fibrin mesh as well as clot throughout the polymer, and this is due to the high surface area and the porous morphology. Over time, the clot is replaced with mature connective tissue, which leads to a more permanent occlusion. It does take a few minutes for the polymer to expand fully in the target vessel, so what I'm showing here is just what this plug looks like in its crimped form, and then what it looks like in its expanded form. And I also included the specs for the 3 different models that are available right now, and these models allow for embolization of blood vessels ranging in size from 2 to 10 millimeters in diameter. This is what this particular plug looks like in a patient with pelvic venous disease. You can see what it looks like as it's being delivered on the image on the left. You can see the marker up at the top of the image showing the marker at one end of the polymer, as well as the coil that's being delivered through the catheter below. The second image shows the coil and plug delivered. And then finally, we actually used 2 of these during this case, so you can see what 2 of the plugs look like sequentially positioned inside the gonadal vein. The second version of the Impede plug is the Impede FX. This plug consists only of the shape memory polymer without an anchor coil. It's available also in 3 sizes to treat vessels up to 10 millimeters in diameter. It's the same self-expandable polymer plug as the Impede with the same characteristics, and again, there's only a single radiopaque marker at the proximal end of the plug. Therefore, it looks similar in its crimped form and expanded form, and again, these are the specs for the device in comparison to the Impede plug. And this is just an example of what it looks like under fluoroscopy in a renal transplant that we were embolizing. Here's the Impede plug. Here's the pre-embolization angiogram. Then the image on the right shows the single plug in place within the target transplant renal artery. You can see there's just a single marker present. Many of the plugs that I mentioned are so new that there's really not a lot yet known about them, and the specific strengths that might lead to preferential use in any or all situations haven't yet been defined. When I talk about embolization, I like to stress the delivery catheter because I think the delivery catheter is the most underrated part of an embolization procedure, and this holds true with plugs as well. Different plugs require different catheters for delivery. I tried to lay this out in these 2 tables, and I want to point out some things to you. First of all, only 3 of all the plugs I mentioned are able to go through a microcatheter, and these include the 2 smallest versions of the MVP plug and the smallest version of the Caterpillar plug. So if you're looking for a device to pass through a microcatheter, these are the only ones that are available for you to do that right now. The devices in purple go through an angiographic catheter, meaning a catheter with an 035 or 038 lumen. And this is the AVP4 plug, the 2 larger versions of the MVP plug, the middle size of the Caterpillar plug, and the smallest sizes of the Impede plug. All the remaining devices require a guide catheter or sheath in order to deliver these coils. So this means that your ability to use a specific plug will be determined by your ability to get the necessary delivery catheter where it needs to go. In conclusion, plugs are important and efficient devices for mechanical embolization. There are several new plugs that have recently been introduced, and I think it's going to be important for us to understand the nuances of each of these products so we're able to take advantage of their strengths and avoid their weaknesses.